Nursing 474, Perspectives in Global Healthcare. The weekly learning objectives include describe specialization in public health nursing and community health nursing and the practice goals of each, identify clinical community nursing practice with population-focused practice within your own community. Number 3, describe contributions made by early nursing leaders and their application in community health in a modern world. And number 4, discuss the core competencies of public health nursing. The goal of health for all by the year 2000 was first proclaimed at the World Health Organization Health Assembly Alma Ata in 1978. The original initiative has been revised over the years and is now referred to as Health for All in the 21st century. The initiative has always identified primary health care as the strategy to best attain the goal. Nurses must globally astute and become involved in helping to ensure that these goals are obtained by the people of the world. Developed countries tend to have stable economies with advanced industrial and technological development. The more developed the countries in general place greater financial emphasis on the health care needs of their populations. In addition to direct health problems, increasing populations, migrations within countries, political corruption, and lack of natural resources and natural disasters affect the health and the well-being of populations. Additionally, as we talked about before, the effects of war and conflict have devastating effects on a country and the health of its population. The increased incidence of violence against women and children, the hazards of unexploded weapons and landmines, and the occurrence of earthquakes and other natural disasters increases health risks. In many countries, there is a lack of political commitment to healthcare, lack of recognition of basic human rights, failure to achieve equitable access to healthcare, and inappropriate use of resources that support healthcare. The role of population health. Population health relates to the health outcomes of a group of individuals, including the distribution of such outcomes within the group, and includes health outcomes, patterns of health determinants and policies, and interventions that link these two. It is a holistic approach and perspective that focuses on a broad range of factors and conditions that have a strong influence on the equity of services and a population's health, and applies the approach at population level rather than an individual level. The role of primary health care in a global health is historically based on WHO's Health Assembly held in 1998. In 2003, WHO and UNICEF reinforced, modified, and updated their aims to incorporate such services as an organized approach to health education that involves professional healthcare providers and trained community representatives, aggressive attention to environmental sanitation, especially food and water sources, involvement and training of community and village health workers in all places and intervention programs. Another one is development of maternal and child health programs that include immunizations and family planning. Another service is initiation of preventative programs that are specifically aimed at local endemic problems such as malaria and schistosomiasis in tropical regions. Another service is accessibility and affordability of services for the treatment of common diseases and injuries. Availability of chemotherapeutic agents for the treatment of acute, chronic, and communicable diseases. Development of nutritional programs is another service, and promotion and acceptance of traditional medicine. There's 12 characteristics of public health care. The characteristics include general in scope, accessible, integrated, continuous, dependent on teamwork, holistic, personal, family and community oriented, coordinated, confidential, and plays in advocacy roles. Nurses have an important leadership role in healthcare throughout the world, providing knowledge, skills, guidance, direct services, and educational and health promotion services. Unfortunately, in lesser developed countries, the role of the nurse is defined poorly, if at all. Nursing is not valued, and the ability of nurses to contribute to improving an individual's health, much less a community's health, is minimal. Much work is needed to raise the bar in the education of nurses in these countries and overcoming some of the cultural and gender role barriers that makes this process laborious. Major global health organizations include organizations such as WHO and UNICEF. These organizations receive funding from multiple government and non-government sources. The major ones are part of the United Nations. They provide direction, coordination, technical assistance, and/or funding to countries to improve the health status of their populations and/or training of health personnel at the community level. Bilateral organizations, such as the U.S. Agency for International Development, operate within a single less developed country and are influenced by political and historical agendas that determine recipients of aid based on such factors as economic benefits, national defense, medical research, and protection of private investments. Global health is not just a global health agenda. It does not begin with and end with the individual. It must consider all factors within a country that affect health, such as environment, education, national, local policies, healthcare, access to healthcare, economics, war, and public safety. There is a relationship between the health of a country's population and its economic, industrial, and technological development. The economics of international development are complex, but improving the overall health status of the population contributes to the economic growth of a country in several ways. There is a reduction in production loss. There is an increase in the use of natural resources. There is an increase in the number of children attending school and eventually participating in the economic growth of the country. There is also an increase in monetary resources formerly diverted to disease or illness. Despite gains made in improving health to many around the globe, the increasing population, decreasing food and water sources, and increasing poverty related to global economic crisis all contribute to a critical demise in health. Money that was once used for health care has been diverted to paying off growing debt. Communicable diseases that are often preventable are still common, and even more so in developing countries. Both developed and less developed countries are seeking ways to cope with the aging of their population and the associated increase in non-communicable and chronic forms of diseases and disabilities. Illnesses such as AIDS, TB, and malaria still persist and are now becoming drug resistant. The Global Burden of Disease Indicator, developed by WHO and the World Bank, combines losses from premature death and losses of healthy life that result from disability. Premature death is the difference between the actual age at death and life expectancy at that age in a low mortality population. People who have debilitating injuries or diseases must be cared for in some way, most often by family members, and thus they no longer can contribute to the family's or the community's economic growth. The disability adjusted life years is a measure of GBD that recognizes that such conditions such as psychiatric problems, although not traditionally considered a major problem, have a huge impact on populations. Communicable diseases still account for the greatest proportion of calculated disability adjusted life years worldwide for both males and females, followed by non-communicable diseases and injuries. Communicable diseases are conditions that contribute to 1/4 of the GBD worldwide and include diarrheal disease, respiratory infections, worm infestations, malaria, and childhood diseases such as measles. Smallpox was successfully eradicated during the 1960s and 1970s through immunization campaigns. Diarrheal disease is one of the leading causes of death and illness in children under 5 years of age throughout the world. Some of the leading causes include nutritional deficits, viruses, bacteria, environmental toxins, and parasites. Maternal health is central to the health of women as well as the well-being of their children and families and the economic productivity of their countries. A woman's ability to survive pregnancy and childbirth is closely related to how effectively societies invest in and realize the potential of women not only as mothers, but as critical contributors to sustaining families and transforming nations. WHO and UNICEF have begun a global initiative to reform the health care received by women and children throughout the world. Most deaths to women around the world are related to pregnancy and childbirth. Access to family planning, good nutrition, prenatal care, and safe birthing practices is limited, if available at all, in many less developed countries. A large portion of the world's burden of disease may be attributable to poor nutrition by itself or accompanying disease. Poor nutrition is often associated with poverty. Protein, iron, vitamin A, zinc, iodine, folic acid, and calcium deficiency are among the leading nutrient deficiencies. Women and children are the most affected by poor nutrition. Improved nutrition is related to stronger immune systems, decreased illness, better maternal-child health, longer lifespans, and improved learning outcomes for children. Poor nutrition also leads to stunting or low height and weight for a given age. Worldwide initiatives directed at overcoming nutritional deficits include control of infectious diseases, nutritional education, control of intestinal parasites, micronutrient fortification of food, food supplementation, and food price subsidies. Natural disasters such as earthquakes, tsunamis, hurricanes, cyclones, floods, droughts, and other natural hazards continue to cause deaths, injuries, and economic losses each year around the world. Massive extinctions of animal species, forests, and ecosystems that support marine life pose additional threats. The aftermath of a natural disaster may be as devastating as the disaster itself. Man-made disasters, a nation's ability to respond to the threat of man-made disasters such as bioterrorism depends in part on the ability of healthcare professionals and public health officials to rapidly and effectively detect, manage, and communicate during bioterrorism events. Surveillance systems, both national and international, are used to track potential risk for intentional harm to the people of the world. WHO monitors disease outbreak using the Global Outbreak Alert and Response Network, linking 72 networks around the world using systematic disease intelligence and detection to verify outbreaks and determine the level of global alert and response required, if any. The four primary tasks of the system are systematic disease intelligence detection, outbreak verification, immediate alert, and rapid response.